I'm Princess Milke Alsato, a first-year nursing student at Emilio Aguinaldo College. Today, I'll be performing a return demonstration on assessing the ears and hearing. This assessment is crucial in evaluating the structure of the ears, checking for any abnormalities, and testing the client's hearing ability. I will demonstrate the proper techniques to ensure a thorough and accurate examination. Let's begin! Planning. It is important to conduct the ear and hearing examination in an area that is quiet. The location should allow the client to be positioned in a sitting or standing at the same level as the nurse. Preparation. Assemble equipment. Otoscope with several sizes or ear specula. Tuning fork.
Procedure 1. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Good day, ma'am. I am Princess Milke Alsato, your student nurse for Emilio Aguinaldo College. Today, I will be assessing your ears and hearing. This assessment will help me to check for any abnormalities such as pain, hearing difficulties, or structural issues. Before we start, ma'am, may I know your name po?
Daniela Wade-Saltan,
And birthday po?
April 5, 2007.
Thank you, ma'am. During the assessment, I will ask you a few questions about your hearing and ear health. Inspect the outer and inner structures of your ears and perform simple hearing tests. Your cooperation is important. Please follow my instruction and stay relaxed, and let me know if you feel any discomfort at any point. The result will help determine if any follow-up care or treatment is needed. To perform hand hygiene and observe other appropriate infection control procedures. Now, I will perform hand hygiene to ensure cleanliness and infection control po. So, disinfect my hand po and wear my glove. Oh. Third, provide for client privacy. Now, I will just close the door and the curtain if that's okay with you po.
Yes po.
Okay. Or inquire if the client has any history of the following: family history of hearing problems or loss, presence of any ear problems or medication history, especially if there are complaints of ringing in the ear, tinnitus, hearing difficulty, its onset, factors contributing to it, and how it interferes with activities of daily living. Use of corrective hearing device when and from whom it was obtained. Ma'am, before we proceed po, I'd like to ask a few questions about your ear health po. Your answers will help us to understand any concern you may have po. So, first question po, do you or any family members have a history of hearing loss po?
No.
Yan. How about, have you ever experienced any ear pain, ringing in the ears like tinnitus? Or difficulty hearing?
No.
No. Okay. And have you been taking any medication that may have affected your hearing?
No.
None. Okay. If you have hearing difficulties po, when did they start and what factors make them better or worse? None. None din po. Okay. Do you use any hearing aids or corrective devices?
No.
Okay. Okay, none. Thank you po. Procedure 5. Position the client comfortably seated if possible. Ma'am, can you please sit comfortably with your feet flat on the floor po and your back straight while I proceed with the assessment po? Okay, thank you. Assessment. Next, we will be assessing the client's uricles. Inspect the uricles for color, symmetry, and size and position. To inspect position, note the level at which superior aspect of the auricle attaches to the head with relation to the eye. Assessment 2, palpate the auricles for texture, elasticity, and areas of tenderness. Ma'am, now I will begin by inspecting the outer parts of your ear, and I will now gently touch your ears to check for tenderness and abnormalities. Please let me know po if you feel any discomfort po. Do you feel any discomfort po, Baki?
No.
Okay. How about upward? Did you
No.
feel anything?
No.
Backward?
No.
Downward po?
No.
How about sa kabilang ear? Feel anything po?
No.
Okay, upward,
No.
downward,
No.
and backward po.
No.
Okay, thank you. Assessment. Next, we will proceed to the assessment of external ear canal and tympanic membrane. Our first step is to inspect the external ear canal for cerumen, skin lesions, pus, and blood. Next is to visualize the tympanic membrane using an otoscope. Attach the speculum to the otoscope. Use the largest diameter that will fit the ear canal without causing discomfort. Keep the client's head away from you and straighten the ear canal. For an adult, straighten the ear canal by pulling the pinna up and back. Hold the otoscope either right side with your fingers between the otoscope handle and the client's head, and upside down with your fingers and the ulnar surface of your hand against the client's head. Gently insert the tip of the otoscope into the ear canal, avoiding pressure by speculum against either side of the ear canal. So, typically, an otoscope is used for this step, but for this instance, we will using a pen light to check for any visible issues. This one. Now, ma'am, I will check the inside of your ear canal and eardrum using an pen light po. Allow me to touch your ear po. Okay, it's set. Now straighten the ear canal by pulling the pinna up and back. And the other ear naman po. Up and back po. Okay. Thank you, ma'am. Now inspect the tympanic membrane for color and gloss. Now allow me to check your ear once again po. Okay. At your ear naman po. I will now proceed with the gross hearing acuity test to assess her ability to hear and detect different sounds. First, I will be assess the client's response to normal voice tones. If the client has difficulty hearing the normal voice, proceed with the following test. Ma'am, I will now assess your response to normal voice tones to check your hearing ability. Ma'am, can you hear me?
Yes.
Okay, sige here po. If the client does not respond or has difficulty hearing, I will proceed with the following test, which is whisper test and tuning fork test. First, perform the whisper test to assess high-frequency hearing. Have the client occlude one ear out of the client's sight at a distance of 0.3 to 0.6 meter or 1 to 2 feet. Whisper simple phrases like, "How are you?" Ask the client to repeat the phrase. Repeat to the other ear using a different phrase. Ma'am, now I will perform the whisper test to assess your high-frequency hearing. Please repeat the phrase after me po, and I'll ask you to cover one ear while I whisper based from about 1 to 2 feet away po. Here muna. Cover the ear. Okay. Okay. That's great. Now please Cover the other ear naman po. I'll whisper different place po.
How are we?
Okay, that's nice. The client can hear you both ears po. Second, tuning fork test. This includes Weber's and Rhine's test. First, I will be perform Weber's test to assess bone conduction by examining the lateralization sideward transmission of sound. Hold the tuning fork at its base. This one. Base and activate it by tapping the fork gently against the back of your hand near the knuckles or by stroking the fork between your thumb and index fingers. Fork. It should be made to ring softly. Place the base of the vibrating fork on the top of the client's head and ask where the client heard the nuts. This one. Okay. Mama will now perform a hearing test using a tuning fork. This will help assess how the sound traveled through your bones and ears, and I'll be placing the tuning fork on the top of your head or forehead. And please tell me if you hear the sounds equally in both ears po, or if it's louder in one ear than the other po. Okay, can hear both side of the ear. Next, we will be conduct Brine test. To compare ear conduction to bone conduction, hold the handle of the activated tuning fork on the mastering process of the ear until the client states the vibration can no longer be heard. Immediately, hold the still vibrating fork of the client's ear canal, push aside the client's hair if necessary, ask whether the client now hears the sound. Sound conducted by air is heard more readily than sound conducted by voice. The tuning fork vibration conducted by air are normally heard down. Now for the Rhine's test, I will place the tuning fork behind your ear and let me know when the vibration stops po. The sound will stop po. Then, the other side of the ear. The sound stop. Okay, so then can both to this spot. Thank you. This test help us to determine if air conduction is greater than bone conduction, which is normal po. Lastly, document findings in the client record supplemented by narrative notes when appropriate. Thank you, ma'am. That's conclude our ear and hearing assessment po. Based on the findings, I will document everything and share the results po with the healthcare team for any necessary follow-up. And I will now sanitize and remove my gloves. That's all po. Thank you.